Diabetes frequently presents itself in women with a variety of different symptoms. In today's video, we will provide an in-depth discussion of the common symptoms that may indicate the presence of diabetes. In order to take control, the first step is to have an understanding of these indications. So, now let's get into further detail. Number 1. Skin changes. The changes that occur on your skin might be a subtle indication that there is anything wrong with your blood sugar levels. Acanthosis nigricans is a particular alteration that should be kept an eye out for. This condition manifests itself as black, velvety patches that are frequently seen in folds of the body such as the armpits, neck, or groin. One of the defining characteristics of type 2 diabetes is insulin resistance, which is strongly associated with this skin disease. It is possible that the body will become more insulin-producing in an effort to make better use of the hormone. A surplus of insulin can then cause skin cells to proliferate at a high rate, which might result in the appearance of these conspicuous patches. When it comes to women, seeing changes like these might serve as a reminder to check for diabetes. Alterations in the skin do not, on their own, constitute a diagnosis of diabetes. Nevertheless, when combined with other symptoms, they may indicate the necessity of a blood sugar examination. Number 2. Yeast infections. There is a possibility that yeast infections, particularly those that are recurrent, are more than simply an annoyance for young women. Yeasts are attracted to sugar, and when there is an excess of sugar in the blood, which is a regular occurrence among diabetics, it may also wind up in the vaginal region, which creates the ideal habitat for yeast to thrive there. As a consequence of this, women who have high blood sugar levels may discover that they have to deal with yeast infections that are more persistent and occur more frequently. Therefore, if you are seeing that these illnesses are occurring more frequently or are more difficult to cure than they normally would be, it is possible that your body is sending you a warning sign about high blood sugar or even diabetes that has not yet been recognized. Although only a small percentage of people who experience recurrent yeast infections also have diabetes, the condition is substantial enough to deserve attention and maybe a checkup. Number 3. Blurred vision. Diabetes may be a fairly stealthy indicator, and one of its symptoms is blurred vision. Eyes can be affected by fluctuations in blood sugar levels that are either too high or too low. More specifically, the capacity of the lens to focus can be affected. The operation is as follows. Sugar that is present in the circulation in excess can cause fluid to be drawn out of tissues, including the eyes. As a result, the curvature of the lens may be temporarily altered, which will have an impact on your vision. This unexpected blurriness can be upsetting for many women, and they may experience it intermittently as a result of fluctuations in their sugar levels. Even though it is a symptom that can be reversed, it should not be disregarded. If you experience persistent or repeated blurred vision, particularly when it is accompanied by other symptoms associated to diabetes, this might be an indication that it is time to check your blood sugar levels and seek the advice of a medical professional. It is important to keep in mind that early identification and care can make life or death. Number 4. Fatigue. A long day of work or a lack of sleep are not the only factors that can lead to fatigue, which is characterized by a persistent sense of tiredness or exhaustion. When it comes to diabetes, one of the symptoms that might be the most striking is persistent fatigue. Having high amounts of glucose in the blood can make it more difficult for the body to adequately distribute glucose, which is the major source of energy, to the cells. When it comes to women, this indicates that even after a full night's sleep, they may have feelings of exhaustion or a lack of energy to engage in everyday activities. It is possible that undetected diabetes or problems with blood sugar regulation are the cause of persistent feelings of weariness, particularly when these feelings are accompanied by other symptoms. Despite the fact that fatigue is not a diagnostic indicator of diabetes on its own, it is a warning that should be taken seriously, particularly if it is chronic and cannot be explained. Final words. In order to facilitate early diagnosis and management of diabetes in women, it is essential to recognize the indications of diabetes. In the event that these symptoms manifest themselves, it is imperative that women pay attention to them and seek the advice of medical specialists. Identification at an earlier stage not only facilitates more efficient management of diabetes, but also has the ability to avert future consequences. Therefore, make sure to watch this video in order to learn how to avoid these symptoms. And if you found this video to be useful, please subscribe to this Natural Life Hacks channel. I am grateful that you watched.